experts are warning that the COVID-19 pandemic has resulted in a massive shortfall in tuberculosis funding. The World Health Organization says for the first time in a decade, TB deaths have increased significantly in 2020. Let's get you more on these shortfalls and the significance of World TB Day. We're joined by Rural Health Advocacy Project Director Russell Rensburg, who joins us via our video link this morning. Russell, it's great to have you with us on the program on such an incredibly important story, especially because of South Africa's contribution, shall we say, in terms of the TB burden around the world. We're one of 30 countries around the world with some of the highest burdens of TB.
No, certainly we are. We have one of the highest, and TB accompanies our HIV pandemic, and for the first time in over 10 years,
sure,
we've seen an increase, even locally, in TB deaths. It's off the highs of about like 160,000 people were dying annually in the early days of the HIV pandemic, down to around 58,000 in 2019.
Mm-hmm.
But that number's now gone up to about 61,000. And a lot of that can be attributed to the drop in TB case notifications during the COVID pandemic.
So tell me, on the ground, what does this look like? So people are getting sick, they're not going to hospital, and people who are already sick are not getting the treatment that they need to get on a regular basis?
Yeah, well, it simply is. TB is interesting. It contributes to it's one of the leading causes of death in South Africa. And I think part of the challenge is that it's really just about health system responsiveness and awareness. So TB is curable, but in order to get access to treatment, you need to be screened and tested. And when you're positive, you need to be linked with care. And I think with the interruptions around the singular focus on the management of the COVID pandemic, with which we did quite well, we had a sharp drop in case notifications. And as those drop, we then have those increase in deaths.
Yeah.
But with the right kind of approach, there is a plan in place. I think we can get a bit back on track. But what we need is some prioritization and political leadership.
So
unfortunately, at the moment...
No, please finish your thought, Russell.
But unfortunately, at the moment, 61,000 deaths in the last year could have been avoided. And that's 61,000 families, that was affected with this. And we're already dealing with this big pandemic of grief. But we can change this.
Yeah, absolutely. I mean, effectively what it means, because you're talking about TB being curable, but what it means is that more people are staying sick in their communities and more people are passing it on.
Exactly. And I think one of the strategies that we're currently looking to prioritize through our project is that we do have a national TB recovery plan. The plan has a number of different priorities. But I think what we are saying in our report, which we're publishing today, is that within those priorities, there are some immediate ones. And one of those is the targeted universal TB testing.
Mm-hmm.
And by increasing the amount of people that test for TB, we can increase the yield of positive cases, and those positive cases can be linked to care a lot quicker. And by extension, we can then start seeing a decline in TB deaths as we increase TB success rates. But it does require some strong leadership. And I think that's kind of one of the challenges when we look at TB is the poor accountability mechanisms that exist in the implementation of TB programs.
Given the challenges in our health departments in all provinces in the country, and given what you're now saying is needed, a prioritization of this sector of the population, if we look 2 years into the COVID-19 pandemic, and we're talking now about regaining some of the losses due to TB from the last 2 years, in terms of that increase in deaths that we're seeing now, more than we've seen in the past 10 years, how do we balance that out, Russell? Is there a political will that you talk about to actually prioritize this sector?
Look, I think at the end of the day, it's really about making the right investments. We have all the tools available within our arsenal. So one of the things that can really work in our favor is we can use the mechanisms that exist, the funding that exists, just by channeling it towards these priorities. So let's look at TB funding or TB data in the first instance. We have very good data systems, right? But sometimes we have a challenge in connecting those data systems. So on the one side, we can fairly easily track where we're testing and the number of positive patients.
Mm-hmm.
but we can't link those positive patients to the amount of people that are currently in care. So that's a low-hanging fruit, just to address that data gaps. The second thing is really just to look at the financing. We have a strong, we never have enough money for health, but we have some prioritized funding for TB and HIV, and as well as some funding in provincial budgets to fund this expansion. And I think all that we need to do is for the national TB program to start looking at some of the conditionalities in the conditional grants to direct the program. And I think we also need civil society groups like Richetse and others to continue doing the hard work by prioritizing point of care accountability, making sure that we're testing the people, making sure that staff attitudes are correct. And I think slowly we can start regaining momentum.
Yeah.
And I think as we increase that political advocacy, the political support will also increase.
Yeah.
Because ostensibly, you know, we have some kind of political leadership. The Deputy President chairs the South African National AIDS Council, which includes TB care. And I think with increased prioritization and political pressure, we can use the tools that we have to start moving us in the right direction, and in time start beginning investing more in TB.
Yeah.
But TB is really something that we should prioritize. By prioritizing it, we can actually strengthen our health system, responsiveness, and most importantly, we can reduce death.
Yeah.
But all we need is to get together, focus on the core priorities, and move forward.
Yeah, we don't want to take any more steps backward. And everything that you've just outlined, Russell, it is part of a TB recovery plan, which exists.
You know, there's the TB recovery plan is really built on the inputs of a multi-sectoral framework. We have a large group of very good TB researchers in our TB think tank. We have a new director in the national TB program. We've got some strong civil society groups, particularly and especially a civil society focus group on TB. And these came together and brought up this priority plan, which is built on 4 broad pillars. You know, so it's firstly about diagnosing people with TB, so expanding the criteria for who gets tested for TB and not just on symptoms. It's about ensuring linkages to care. It's about strengthening systems for retention. And I think here we've seen in COVID the importance that well-trained and connected community health workers can add on to this. And then lastly, we also have some TB prevention opportunities through, which have just recently been approved by SAPRA. And I think when we get political will and coalesce around this plan, and we start prioritizing those elements that we can do in the short term, which for us is targeted universal TB testing, we can start seeing the shift. But we have to sort of work incrementally and look at the parts of the plan that we need to prioritize in the short term to be able to get the long-term results. Yeah. But it does require leadership.
Yeah, certainly.
And like you say, we can't move back anymore. We have to keep moving forward.
On this World TB Day, it's an incredibly important story that we're tracking here on the AM Report. Russell Rensburg, let me thank you for your time this morning. He's the director of the Rural Health Advocacy Project, talking to us via our video link there this morning. Thanks very much indeed.